Hi, sir. My name is Danny. I'm your nurse practitioner. I wanted to take a few minutes to explain what's been going on and what we found out so far. So far, we've learned that you're experiencing anemia, which means that your body doesn't have enough healthy red blood cells to carry oxygen to your organs and tissues. That explains why you've been feeling weak, tired, and short of breath, and possibly even why you've had that fainting spell earlier. We also saw that your white blood cell count is significantly elevated. This usually means that your body is under some kind of stress, like an infection, inflammation, or even that you're having blood loss. Your blood pressure is also low, and you reported passing dark red blood in your stools. All of this points to a possible GI bleed, a gastrointestinal bleed, likely in your lower digestive tract. GI bleeding can happen for a number of reasons. In older adults, the most common causes includes diverticulosis or diverticulitis, hemorrhoids, angiodysplasia, or even long-term use of medications like NSAIDs, like ibuprofen, aspirins. Sometimes bleeding can be slow and go unnoticed until the anemia becomes severe enough to cause the symptoms. So now let's talk about your genetics and nutrition that come into play with this. First, our genes play a big role in how our bodies absorb and process key nutrients like iron and vitamin B12. These are essential for making red blood cells. If you have a genetic predisposition to something like celiac disease or pernicious anemia, your body might not be absorbing those nutrients properly, even if you've been eating a healthy diet. Also, some people have inherited clotting disorders or conditions that affect how fragile the blood vessels are in your gut. These genetic factors might not cause problems until later in life, when other issues like medication use or aging put extra strain on the system. On the nutrition side of things, if your diet has been low in iron rich foods such as red meats, leafy greens, beans, fortified cereals, that could also contribute to anemia, especially if there's ongoing blood loss. Low vitamin C intake can make iron absorption harder, and over time, even subtle deficiencies can take a toll on your overall blood volume and oxygen carrying capacity. So what's next with you right now is our priority is to identify and stop the bleed, and surgery may be needed depending on what we find. Once you're stable, we'll focus on replenishing your red blood cells, um, possibly with iron supplements, a tailored diet plan, and additional testing if we suspect a genetic or absorption issue. We'll also work closely with you to create a long-term plan to help prevent this from happening again. Whether that means adjusting your diet, checking for nutrient deficiencies, or referring you to a specialist for further evaluation. Please know that you're not alone in this. That many people that come have this same issue. You have a whole team behind you, and we're here to support your recovery every step of the way. If you or your family have any questions, we'll be happy to walk them through the same things we're telling you, or even answer any new questions you may have. But thank you for listening. We'll be checking in with you soon again. Thank you.